A lot of times, patients will ask us, how do we prepare for labor? But one of the first things that I'll answer is a question back to them of, what helps you relax? What do you do when you are stressed? And labor is a very stressful time for a person, and being able to know what your coping mechanisms are. Are you somebody who likes to listen to music? Are you somebody who uses deep breathing? Is there a certain person in your life that is very supportive of you and you go to help deal with your stress? Now, these are things that you have to decide prior to going into labor. Relaxation is learned. It's not instantaneous. You've got to make sure that you know how to relax to make your body able to work as most effectively as possible.
I think your choice of a labor support person is very important. We suggest you surround yourself with the person or people who decrease your anxiety. This may be a significant other, it may be a husband, it may even be a sister. For others, it may be a group of people. You do have to check with your hospital of how many people are able to be in the room with you. But whatever helps you the most is what you need to have.
And a laboring mom might want you to talk as a support person. She might not want you to say a word. She might want you to touch her. She might not want to be touched. She's not going to know this until the process begins. And that's something that the support person needs to respect. And the woman laboring needs to have confidence in the relationship that she has with her support person, that it's okay to say, that doesn't work.
Sometimes your significant other is not the best support person, and people want an extra set of hands there with them as well. So there are doulas as well. A doula is someone who is trained in emotional and labor support during your labor. They do not do anything medical, but they can be very beneficial if your support person has anxiety about the process as well. Some healthcare providers may be there to support you during the birth, during the labor and the birth. And if they are going to be there for the extra support and helping you move and change the positions and labor with you during that time, you may not be as inclined to feel like you need a doula.
Helping people relax during the labor process really depends on also which stage of labor that they're at. In each stage, there's certain things that you can always use. Massage, focusing, helping them take deep breaths, helping them to relax. But let's break it down one step at a time. The first part of labor is always early labor. In the beginning, there's a lot of anticipation, a lot of excitement. Moms are awake, even if it's in the middle of the night. They're excited, feeling usually some cramping. It's kind of coming and going. They might have to go to the bathroom often, all part of it. But I would tell a mom in early labor, try and rest as much as you can, because the hard work is yet to come. Active labor tends to be more intense. It's when contractions are longer, stronger, and closer together. Mom may be feeling very distinct contractions, especially in the front, maybe in her lower back as well. She might actually start feeling a little bit of pressure as the baby's moving down into the pelvis. All of those combined can be very unsettling if you've never done it before. And even for those who have done it before, it can be a little, oh my goodness, now I remember what this is about.
When active labor comes, for those who are not planning an epidural, staying out of bed and moving is the best thing you can do. I try to hold off using hydrotherapy or getting in the tub as long as possible, because really that is going to be your best help. But if you use it when you are 5 centimeters, you don't have a lot to do when you are 9 centimeters and hurting. So I like to start off with walking in the halls. When you get tired of walking, we can get on the birthing ball. We can use different positions in the bed. There's hands and knees. There's a position that I call the throne position, which sits the bed very, very high and drops the legs down and helps the baby with descent as well. As long as I can keep you moving, that's what I want to do. When you do get to a point where you're kind of going, I think I'm done, I need my epidural, that's when I like to pull out the pool, the whirlpool, and say, okay, let's try one more thing. And then I put moms in the pool, and a lot of times they just go, oh, okay, maybe I can last a little while longer. And often that will get us through to the very end. It's all about using the right bag of tricks, using them at the right time, getting through, and then you end up with the end goal of a beautiful baby in your arms.